A study by researchers at the Perelman School of Medicine at the University of Pennsylvania reveals a significant increase in patients admitted with opioid use disorder, OUD, and injection-related infections leaving the hospital before completing treatment between 2016 and 2020, from 9.3% to 17%. The study, published in JAMA, also notes a more than 50% increase in patients with any opioid-related issues leaving the hospital early. The findings underscore the need for patient-centered care that manages pain and withdrawal symptoms effectively to ensure patients complete their treatment, especially with the dominance of fentanyl in opioid overdoses.
If you enjoyed this video, please give it a thumbs up and subscribe to my channel for more great content.